This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Thank you so much to PM&R Scholars for having us. I remember these presentations were so helpful to me as a medical student. So it is a pleasure to be on the other side representing Spaulding PM&R here with my co-chief. My name is Ashley Gurick. I'm a PGY3. I am the administrative chief resident this year. I'm here with my co-chief, Nicole, if you want to introduce yourself.
Hi, everyone. Thanks for having us. I'm Nicole Katz. I am a PGY3 with Ashley, and I'm the academic chief at Spaulding this year.
All right, so I will be going over some program overview, information about our didactics, some highlights about our program, our residents, and Boston. This is our wonderful primary site. This is Spaulding Rehab. We are located in Charlestown, Mass, which is a neighborhood just north of the main downtown Boston. We are overlooking the water, so we're right on the bay, the Boston Harbor. So we have beautiful views from many of our patient rooms and conference centers, and a great little walkway right out front. We are an advanced program, which means you will complete 1 year of preliminary or transitional training, followed by 3 years of your PM&R training at Spaulding. I'm sure most of you are aware of the variety of fellowship opportunities that you can get following a PM&R residency. I just want to take a second to highlight the fact that we do have some Spaulding-sponsored fellowships, which are sports, spinal cord injury, amputee, and pediatric rehab that we offer through Spaulding, as well as we have pain management and neuromuscular offered through our Mass General Brigham affiliate hospitals. Every year we do match our residents into competitive fellowships like pain, sports medicine, a variety of neuro rehab, neuromuscular, and we also have residents who go straight into general practice and have been very successful in getting job opportunities, competitive job opportunities in a variety of different settings. We are affiliated with Mass General Hospital, Brigham and Women's Hospital, as well as Harvard Medical School. We are proud to be the #3 rehab hospital in the country, according to US News and World Report. We welcome 8 residents per year. I just had the pleasure of onboarding our new 8 residents, which was super fun. We rotate through a variety of major Boston hospitals like Mass General, Brigham and Women's, the Boston VA system, Boston Children's Hospital, and several Spaulding satellite hospitals and outpatient sites. We have opportunities to rotate through all of the core PM&R rotations like spinal cord injury, brain injury, concussion, stroke recovery, general rehab, amputee, P&O, burns, pain, pediatrics, and sports medicine. As a PGY2, majority of your rotations will be inpatient, and kind of as you progress through the program, you'll get more outpatient as a PGY3 and then more outpatient as a PGY4. Importantly, I thought, as a PGY2, I wanted exposure to some of the outpatient subspecialties that I was interested in. So I was appreciative that I did get some outpatient time as a PGY2. As a PGY 3 and 4, we get 2 months each of elective time where we can pick among all the different hospital sites with a variety of different like mentors that we want to do if we want to do any electives with them. We have 5 months total of EMG, so 3 months as a PGY 3 and 2 more months as a PGY 4 that our residents are able to hit their EMG numbers without any problems. We do also offer a teaching rotation rather as a PGY 4, but we'll have one PGY 4 resident who stays on the inpatient side, and essentially their entire role is to teach the residents who are working on inpatient services. They'll do little teaching sessions about whatever the residents want to learn about. As far as our call structure, we do have 24-hour in-house call at Spaulding. The only exception to that is one of our PGY 2 rotations at the VA, where we do about 7 to 10 days of home call on that rotation. Otherwise, we do 24-hour in-house call, which means we get a post-call day. Most of our residents are really good about really taking advantage of that post-call day. We have a wonderful in-house call room with a memory foam mattress topper. We have our own bathroom. We have a nice shower. And again, we're overlooking the water, so it's beautiful views. We take most of our call as PGY 2s. Some overnight call as PGY 3s, and then as a PGY 4, you take no overnight call anymore at all. We do use Amion, so it's very easy to swap your call shifts if you ever need to swap for any reason. We have a separate call system called Short Call for our late day admissions, which come between 5 and 9 p.m., which is covered by our PGY 3s and 4s. In terms of benefits, we do offer very competitive salary ranges. We also have the benefit of a $10,000 annual stipend, which can be used towards moving costs, housing costs, childcare, you name it. As of this year, we have a 2% employer 401k contribution, employer-sponsored health insurance. We do have educational funds that are allotted per year, $1,000 as a PGY 2, $2,000 as a PGY 3, and $3,000 as a PGY 4, with additional money if you are presenting at conferences. We do have textbooks and question banks that we have given to us for, the institution sponsors those for us. In terms of vacation, we have 20 vacation days total, which individuals can use at their discretion, meaning the chiefs are not picking your vacation weeks a year in advance. It's actually pretty flexible, and you can kind of work with your attending on which days of the month that you want to take off. We also have 5 conference days and 5 personal days, which you can use however you want with no questions asked. You can even use them as half days to do doctor's appointments or interviews for fellowships, things like that. I do just want to mention that we are union represented as of 2023. Negotiations for our union contract is still in process at this time. So at this point, I will hand it off to my co-chief, Nicole, to go over some more of our didactic and academic curriculum.
Thanks, Ashley. So our didactics are Tuesday mornings, every Tuesday, about 7 a.m. to 1 p.m. Some days will start at 8 a.m., some will go till noon. It's flexible and depends on the schedule for the day. These days are protected time, which means that our program director actually holds the pager during these hours of didactics. So residents are not getting paid, you're not doing clinical care, you're there to learn. Our lectures are largely faculty-led. Residents will lead certain sessions, but we really try and take advantage of the place that we are and bring the experts to you while you're learning, but also give you the opportunity to teach yourself and your co-residents. So as far as what we're doing in didactics of themselves, so we bring in both physiatry attendings, but also attendings from neurology, anesthesia, rheumatology, some surgeons. We'll bring our therapists in, so you get a really comprehensive education. Our topics are going to cover the breadth of PM&R, so you'll get all of that, but we also have some really special longitudinal topics that I want to highlight here. So we do have a strong research curriculum and journal club. What I mean by this is that every month we have a journal club where we're reviewing both the topic that's being discussed in the journal, but also the methods and the stats that are being done for that article. Our research curriculum is every other month. We have a statistics course that we go over with one of our attendings, Dr. Dinesh, who leads the research curriculum, and we have a research track that's been formalized for this year for those that are interested in pursuing more research in their career. We also have long-term curriculums involving QI projects, as well as board review, and our resident finance committee puts on lectures throughout the year so that we have really a wealth of knowledge of finance. So you're taking care of that in addition to your medical knowledge. Other things that we do is we have a DEIA curriculum. So DEIA being diversity, equity, inclusion, accessibility. That is led by our READY curriculum, a READY committee. I'll get into that a little bit more. READY committee is a resident run committee. Another really special thing that we have here at Spaulding is our lifestyle medicine opportunities. So we have some lectures from lifestyle medicine physicians, and we also have a lifestyle medicine track that's already established that you can join if that's of interest to you. Our ultrasound curriculum is one of my favorites. So this is one of the best things I think we can do during didactics for those who want to practice ultrasound guided injections or diagnostic ultrasound in their future careers. So we review all the major joints of the body. They each get their own didactics morning. So that's 4 to 5 hours of a session focusing on just scanning that one joint. We do that under the leadership of our sports attendings and sports fellows. So we have some lecture about what we're going to do. We break up into small groups to practice actually scanning with these experts in the room. We come back together, we troubleshoot, we keep going, and we do this every single year. So you have multiple times to really work on this with those attendings and fellows available to ask questions. The other really special part about this, go back, is that the end of your residency, you have the option to take an exam to graduate with a distinction in musculoskeletal ultrasound. So Anatomy Week is one of the highlights of the year. We just wrapped it up this past week. It's a big focus at the beginning of the year to start off really strong. So our mornings are spent at Harvard Medical School Library, where we have lectures from our sports and pain attendings going over certain joints. We go over anatomy, pathology, exam review. And then in the afternoon, we go to our cadaver lab at Harvard Medical School, where we review with the anatomist on cadaver donors, those joints, and then we also practice ultrasound of those joints. So I want to go back to READY for a moment and give it a full slide, a full shout out. So READY stands for Residents Educating and Advocating for Diversity and Inclusion. It's a resident run committee here at Spaulding, but it receives a lot of support from the institution at large. Connie, who's pictured in the bottom right there, is the PGY4 who's leading it this year. I wanted to give her a shout out. So READY works to bring in awareness, inclusion, equitability, and accessibility to Spaulding, both through education in our didactic series, as well as through engagement with the community and really wonderful initiatives throughout the hospital. And we can talk more about that if there's of interest. A resident clinic is also something that happens Tuesday afternoons. So your Tuesday might look like you have didactics in the morning and then you have your resident clinic in the afternoon. So you're really based at Spaulding on most Tuesdays. Once you join Spaulding as a PGY2, you're placed in a resident clinic group, and that's your group for the full residency. Groups are split up where they either have their clinics on the first and third Tuesday of the month or the second and fourth, which means you're seeing your resident clinic patients twice a month, essentially. The patients you're going to see are post-discharge patients from when they were inpatient. So you might have the pleasure of seeing someone inpatient and then discharging them and following them longitudinally outpatient, which is really special. We'll also see patients with brain injuries or strokes who are referred to us. And then injections that we'll be doing might be Botox or ultrasound guided joint injections. Conferences, we love conferences. So most residents go to AAP and APM&R. They'll also be going to their specialty interest conferences. As Ashley reviewed, you have really robust funds to support this. And you also have those days off to support you going without you having to compromise any well-being. Our wellness curriculum is also run by our wellness committee. That's a resident-run committee that's in charge of making sure that we are taking time to enjoy life outside of medicine, both in the hospital and outside the hospital. So last year we had some really great events. We do pickleball and paddle boating. We do bowling, lots of stuff. They're open suggestions. They're always looking for new things for us to do. And then again, I want to reiterate what Ashley said. So our personal days are unique in the sense where you can email your attending the night before, the day before, whatever you need to do. Let them know you're not coming in, you have some reason, or you don't share at all, and there are no questions asked. That's for you to take care of whatever you need to so you can be well while you're in residency.
About 5 minutes left.
Thank you. Extracurricular opportunities. So we do things beyond being in the hospital. So sports coverage is a big thing that we really love to do here, just because there's so many opportunities and we love who we get to work with when we do that. So we'll cover the marathon, we'll cover adaptive sports, we'll cover dance. We do a lot of pre-presentation physicals. We also get to do sideline coverage with our fellows. There's a really great opportunity to learn with them while things might not be active during the game. And then if an emergency comes up, you're there to help and you get to learn with them as you're doing. And so they'll be covering football, soccer, and ice hockey. We also really like to get engaged in our community. There's a robust effort of that coming from Spaulding. So mentoring is a big one. We have already set up systems to connect residents with Harvard undergrad, MIT, Harvard Medical School, and then Ready has also worked to create an alliance with one of the local local high schools. And so they can connect with us, come shadow for a day. And then if there's an interest from the mentee, to continue a conversation more with that resident. Our hospital. So we just talked about what we do. This is where we do it. So Spaulding is really beautiful. We're very fortunate. On the top left, you'll see our rehab gym. So that is where the inpatient patients will come to do their therapy. There are therapy gyms that are smaller on some of the floors, but this is the main rehab gym. Those beautiful big windows are looking right out over the harbor. And then off to the right of it is a rehab patio. So in nice weather, our patients can actually go outside and do their therapy. To the right, on the top right, you'll see one of our conference rooms, just another beautiful space. This is where we have our team meetings. Again, you're looking out right over the harbor. On the bottom left, this is actually right behind the hospital. So we have this really special area with multiple different terrains for our therapists to work with our patients during their therapy sessions on how to traverse multiple terrains. So you'll see we have grass, we have cobblestones, we have gravel, there's some dirt there. And then if you go actually around the corner, you'll reach an adaptive playground, which is actually not owned by Spaulding. It's part of the community. And so you'll both have patients participating. You'll also have just community members coming to play, which is really special. And then on the bottom right, the picture shows one of our floors. So most of our floors look very similar to each other. This happens to be our 5th floor. The front's going to have the nursing station. That's what you see right in front of you. And then all the rooms around it are going to be single-use patient rooms. For residents, so this is us just doing some fun things. So again, covering marathons on the bottom left. On the top right, we are learning about adaptive sports. So you can see some of us using hand cycles. On the bottom right, going hiking, and then the middle and the bottom, we're practicing some upper nerve root tension signs during anatomy week, but having a good time. And then this is where we live. So Boston's great. You're close to a lot of different things. In Boston, when it's colder, there's skiing. When it's warmer, there's beautiful hiking right outside the city. So you're really close to Maine and New Hampshire. Vermont is really close. New York is not too far at all. You're a 6-hour drive from Philly. We have lots of sports. We have beaches that you can go to. Our residents themselves tend to live right around the city or in the city itself. Some live in Charlestown, which is right next to the main hospital as well. So there's lots of different options depending on what you're looking for. So I will stop here. This is again just a nice picture of Spaulding that we love. The email up there is spaldingchiefs@partners.org. Feel free to email us with any questions you have. You can also follow us and reach out on Instagram or Twitter. And we are happy to take any questions.
What about 1 minute?
We're happy to jump into questions early.
I see a question here. Thank you for the presentation. Does the program accept US IMGs? Yes, we absolutely do. We have a couple in my class here. Is there a graduation or board score cutoff? I do not believe we have a graduation or board score cutoff. I can get a definite answer for you on these questions. If you can email us, that would be great. Are we allowed to rotate observe? Absolutely. We love having rotating medical students. I'm part of the medical student education committee. I have a student with me almost every month. I will give you the contact information for Dr. Dorothy Tolchin, who's in charge of our medical student rotations. Could you attend virtual didactics? We're currently not offering our didactics virtually. Unfortunately, we were, but we're back in person now. But we'd love to have you attend if you do come and visit with us on an away rotation. Brandon, Dr. Sue, I will definitely tell her you said hello. Moonlighting is an option. We are allowed to moonlight actually internally as Spaulding moonlighters. So over the weekends, we're very fortunate to have moonlighters who actually cover our services on Saturday nights and on Sunday nights. We as residents can be those moonlighters as well. So we are basically covering the entire hospital and being paid as moonlighters. We also have the opportunity to moonlight at the Boston VA, which you can do. So you can start moonlighting as a PGY 3 or a PGY 4, and you have to have your steps 3 scores in for that.
I do apologize. We're going to have to move on to our next presenters. Thank you so much, Spaulding.